I would like to welcome our first speaker. That's Olli Stegle. Oliver Stegle is a researcher at EMBL and DKFZ. And he's interested in genomics and its implications on human disease. He will talk to us about GHGA, where he is also a director and spokesperson. And yeah, his talk will give us the overview of the vision of GHGA and its implementation. Oliver.
Thank you, Susanne, for the kind words. And also a big welcome from my side. Thanks for joining us here in so numerous, and also for those online. It's really great every year to see the GHGA Annual Meeting has become a tradition. And I think this is an exciting year because we've actually launched our main product, and you will hear more about the progress of what we've been doing. Susanne mentioned that I'm actually a scientist by training. And when we started GHGA, quite a few years ago, we were actually starting with this sort of a situation in Germany. Namely, many of the scientists are involved in a number of activities, international activities that generate genome data at scale, rooted in research initially. We'll see this change later on. The 1,000 Genomes Project, the first time applying genome sequencing to a larger cohort, ICGC, big cancer efforts to create landmark papers, right, and activities and characterizing genomes. Pan-cancer analysis working with another big cancer effort, the human cell atlas, and now human pan-genome activities. And in many of these areas, the scientists in this country were very much involved. There's also a paper outcome, publications, the papers we and others have actually written in this room, but there was really lack of infrastructures of making data available to democratize data. And it was really perceived by many in the community that this sort of hinders progress, that we can really properly make progress if we have data available, if we also have infrastructures to store data and overcome the bottlenecks of making genome data fair. So the vision at the time, I'll be brief here, is to create such an infrastructure that is nationally coordinated, interdisciplinary, integrating genome research and healthcare. That was the vision from the very beginning, and it's really exciting how we see this. I really like to refer to this bridge. Genomic data really originally come from the research domain. This is where everything started, now almost 20 years ago, really, where genome sequencing became applicable at scale. But obviously now we increasingly see this transition that healthcare is entering the arena. We're generating genome data, other omics modalities in healthcare. We need to figure out how we get data from the right to the left, but also how do we get the insights back? That actually what is being developed in an effort in a research arena can actually help people. So that was the idea to do that. To create an infrastructure for researchers. So research is obviously key, but then also really create this innovation cycle between these two different fields. Just to get one sort of a question out of the way, I talk about genomes because this is the most abundant modality, but what we really mean is any sensitive, personally identifiable modality that's generated from sequencing, omic sequencing, transcriptome, single-cell RNA-seq. All these modalities are very similar. Typically, they are short-read sequencing. You can't share them with neighbors. You shouldn't put them on a laptop, and you definitely want to have them in a very tightly and securely controlled infrastructure. And that's really what I'm talking about. For simplicity, I mainly refer to these data of genomes, but really all the same legal, organizational, and GDPR-wise constraints retain. Genome data are hard to share because once you have someone's genome, you basically can read off relevant information, but most importantly, these data cannot be fully anonymized because of the information content, and that's prevalent, and that really applies to all these modalities you see here on the right. So the other part that is, I think, also very deeply rooted in international engagement and activities is the idea, to do something in Germany, but create a number of bridges and close a number of gaps. And the two gaps or relationships I would like to sort of highlight and then come back to that later. On the one hand, we have a genome research infrastructure, but we would like to have this interplay with big national genome initiatives, in particular in the medical domain. And you will see this later on, Genome.de or now the model project Genome-Seq. But on the other hand, also create bridges to obviously the world around us. Genome data only can be fully leveraged if you analyze them in context, if we utilize data not only in one country, but on an international scale. So we very early on wanted to also create interactions with big European efforts, 1 million genomes at the framework. Then there's the Federated European Genome-Phenome Archive, an infrastructure actually run by EMBL EBI. That's actually where my motivation come from. I spent my first parts of my academic career at the EBI in Kingston, so we wanted to have this connection. And then later on, the European Genomic Data Infrastructure Initiative came live, and we'll hear later on a presentation about that. And obviously, that really sets the ambition to tie activities that we do within one country in a European context to really make data flow and in a European space. So that's where we started, what we wanted to do. And now a few concepts. And what I really want to start with, and that, from the perspective of a scientist who used genome data for a long time, I say that was also a learning curve for us, is, oh, sorry, I forgot that part. Yeah. So the concept, I should say this is, GHGA, I'll come back to that in a second, is really a consortium that was funded within the NFDI. That's a National Research Data Infrastructure Initiative. And for those of you who follow us from outside Germany, we've been really lucky that there was funding and the foresight vision, long-term vision to create stable research infrastructures for all domains of science, including medicine, including genomes, which is GHGA is, but there are many other NFDI consortia, and GHGA is one of the first round consortia funded actually from 2020 on. We span multiple universities, Helmholtz Center, other institutions. We have a federated data hub activity. I come back to that later. So our data hubs are spread across the country, which in many ways reflects the federated nature of Germany politically, structurally, also where data are generated. But actually also that's a vehicle to actually orchestrate also the data volumes that we have to store across the countries. And we're also very much working together with other initiatives, the Denby Cloud, for example, which is part of Elixir Germany, and other activities that provide resources. And we're very grateful for those that we can actually do that. The work streams in GHGA are manifold. We have different activities that we had to bring together and coordinate this. It's on the one hand, architecture, which is really building the machine of having an infrastructure that satisfies all the needs. We have a very strong LC component, bringing ethical and legal aspects together and thinking about how can we lawfully share data, which is obviously a key prerequisite. We have data stewardship and data operational aspects, and that is really, on the one hand, managing these data hubs, but also making data flow in practice. Training is a big activity. Metadata standardizations, how to store data, how to annotate them, what information do we need, community outreach and outreach to the public, workflows, which is really concerned with actually implementing data elements, and then project management. So this is just giving a bit an overview of what's going on. And now I come to my slide that I actually wanted to introduce you, namely, why making genome data fair is so hard. And the reason why it's hard, because you have to bring a number of barriers together. Legal is important. GDPR is omnipresent. Anybody who try to create such an infrastructure will have to learn this lesson. Legal requirements are key. We need infrastructures, and they are also non-trivial to operate due to the scale and complexities of these data. And then finally, we need an architecture that is flexible, scalable, and expandable to a very dynamic landscape, which we see later on. We don't even know yet what are the connecting points in the future. Many of our European initiatives are forming and shaping and contributing. And the final element is this obviously needs to make sense and being used by the community. Perhaps the most important lessons learned over the last few years, and I just want to present you some of the highlights. So the first, I think, key component that we had to implement is develop a federation concept that works for the situation in Germany. I already briefly alluded to the fact that data hubs are federated. They're across a country, and we have 7 of them right now. And we developed a structure how these data hubs are themselves connected to a federal system. We have one central node, which is operated in Heidelberg, really on behalf of the consortium. But that then allows you to data flow. But that's only one part of the federation. The other part of the federation, obviously, is international connectivity. So this whole structure is one entity, and I come back to that later, is fully transparently integrated into a European federation model. And the idea from the outset of the user and our European partners is they talk to one entity, to one structure, to one infrastructure. But obviously, under the hood, we have this fully transparent federation, which we would like to seamlessly make happen without users having to worry about that. The other really component is looking a little bit at the details. And this might sound tedious, but actually it was quite an effort to get to work. And I think also quite a few lessons could be learned. And this is the legal concept that allows you to operate such a one-stop shop. This whole infrastructure is essentially a processor that legally primarily is responsible by GHG Central, who then passes on the responsibility to these hubs. And now what you could imagine is, obviously, how do you share data in such a way that controllers stay in demand, that they stay in the driver's seat? And the way this is happening is essentially via contractual relationship. The data generator or the data owner, controller, producer, which could be quite a number of different things. We come to that later. It could be big national genome initiative. It could be a small researcher who has just generated a small data set. They are contractually linked to GHGA Central via a data processing contract that regulates what are the rules and rights. And in particular, what it regulates is how control is being regulated when a researcher requests data. Researchers find data via our platform, and they also, via the platform, sign the data access request, which is expressing their wish to conduct research to access data. But then the actual agreement contractually is, again, all going back to the controller. And what that really means is that the controller legally, technically, and administratively is in charge. And the infrastructure we establish, if you wish, is the tool to enable the controller their wish to share the data with third parties. Contractually, again, they sign a contract. Once this contract is signed, a signal is triggered, we approve the request, and then finally the data access holds. So you can see, in a way, this is a legally complicated version of establishing a Dropbox for genome data, but it satisfies the sovereignty of the control on the one hand, on the other hand, also satisfies the requirements of GDPR, and it actually also satisfies an appropriate balancing of rights and responsibility that you need for operating such an infrastructure. Just a few operational details. I mentioned several hubs that we've federated across the country that at the moment bring us up on the order of 30 petabytes of storage. So we have actually quite a bit of capacity that we need in the future. We have also compute capacity to run elements on those. And we have established also bridges with sequencing centers. So where data are being generated across Germany, we are really in the process of creating fast-track ingest mechanisms that the metadata can be directly transferred and the research data stays where they are, that we don't have to copy data across the country, but that ideally these data hubs are located where the data sets emerge, where they're being created. So what has happened in the last year? Since we met last year, we have made quite a bit of progress. I think we presented actually in 2023 the metadata catalog, which in the fall last year was our first initial catalog of genomic data. It's on the order of 3,000 whole genomes were provided or enlisted. But the key thing is the catalog wasn't a fully fledged infrastructure that enables seamless access and the whole management of the process that I alluded to. Yeah? It was the first stepping stone. And since last year, we have made good progress. We launched GHGA Archive, actually just in the summer this year, which actually streamlines data acquisition. It also streamlines the requirements to become a federal EGA node, which I think we are becoming very close to, and a unified ethical legal framework. We hope to store prospectively 500,000 whole genomes. This is roughly what our users estimate us, but it will also take some time to ingest all this data because that's obviously a huge major task. There's a future roadmap, which I'll come to back later. We want to particularly think about compute environments. We also want to think about supporting atlases. And this is many things that actually will only happen in the next funding period. We just applied for the renewal of GHGA. So hopefully we'll get the opportunity to implement these steps as we go and actually come to back a little bit more. So just one word about archive. What this archive really enables is, and you can browse the data if you wish here at this URL, is to really bring together all the technical and legal requirements in Germany, which is, we needed independent second factors. We needed to implement address verification to really also tie the research infrastructure side to the legal framework that the parties who via these platforms agree to share data also know that they're talking to the right entity and we have the appropriate bells and whistles. And I don't want to go into details because we have a dedicated presentation about this from Leon Kuchenbecker, who's going to tell you more about the archive. And I believe there's also a short demo. So I'll cut that part here short. What's for us now important is getting data in. I mentioned 500,000. It's a big number. We now launched a call for pioneering data sets to get more data sets in. We work with a number of partners, the Model Project. We're very delighted to have Andreas Till here. So we will work with them. We work with the national cohort who's generating data actually next year. We're expecting 20,000 whole genomes or plus minus to arrive. We work with a number of cancer initiatives and they're all already partially contractually or in the process of being admitted to the project of being going forward. But we also would like to reach out to the community, to the small data generators, and they could follow up on this call to get their data sets in. And you can see the numbers that we're seeing here is quite substantial. What's also, I think, a homework for us here nicely marked in red is, we need still to think about how to actually, in the end, fund storage of these data modalities going forward. It's an ongoing process. We have 30 petabytes. It's not equal 50 petabytes. And we need to think about how we do manage this in the process. But I think for the moment, we're offering everything we can to the community. Community, I mentioned this, is a key component in different areas. So what we have done here is create metadata standards and workflows together with the community. This, on the one hand, thinking about what are the canonical minimal data we need to collect to make genome data shareable, to share them with the world. This was obviously adapted to existing standards, but then expanded. We developed also our own frameworks, also lifecycle management of metadata that we can migrate this to new models. And this is obviously a very important building block. Workflows is another component I would like to highlight. It's really about the first steps towards creating harmonized data processing workflows. And we'll hear about this actually for those who are staying here on site, also more tomorrow by the internal presentations, to really think about how do we process genome data at scale in comparable manners? How do we set standards? How do we actually go towards accrediting workflows in some way, all the way to clinical use downstream? And this harmonization process has been a huge effort in the consortium. And then thirdly, international national alignment. I mentioned our manifold interaction partners, the NFDI itself, the Federal EGA, the Global Alliance. We're now actually a national driver project within the Global Alliance, and we would like to engage with this community within the GDI. And I think creating all these interactions and keeping interoperability has been a huge task going forward. We also spoke with a number of communities, and this is for us really a multi-tier activity. It starts with scientists, clinicians, public, outreach, patients, funders, politics. It's a multi-tier activity that has been very important, very, very, very active. We've also had a public outreach campaign, and this is really also explaining the public what is a genome, why might it be useful to collect them, which is something where you have to really explain people in a country why this is a useful element. There's a podcast, The Code of Life, if you wish. I think that's a half-baked translation, which really explains in German to our users and our patients, perhaps, and the public, what is the utility of genome data and why, in appropriate, secure manner and with appropriate measures in place, they deliver perhaps more added value or more utility than there's the fear about. And there's obviously more developments in patient communication. And we're also very much looking forward to work together with the model project and our partners. And finally, scientific outreach and training. We have a webinar series, and in a way, this annual symposium really fits into this, where we invite experts globally, and we talk about ongoing problems, learn from each other across the globe, users, but also other infrastructures. And there's a number of seminars online, and I think the symposium will very much tie into these activities. Ethical and legal has been a big important, and I just want to highlight a few areas here. On the one hand, we had a very active activity, the Pagoda study, which actually tries to bring a patient perspective on suitable governance model for genome databases. For us, this is important. We are, in a way, a mediator between the controller and the researchers, but it's still very interesting to provide best practices and advice on what are the right governance models that are supported by actually patients. We developed a consent module, which essentially allows us to give advice and provide controllers advice on what is the right consent to request for patients, that actually the data can be shared in infrastructure such as GHGA, that the data can be shared with scientists and can be enabled for secondary use. And there's also been activities and think about how we deal with legacy data. Legacy data might be even pre-GDPR or not appropriately consented, and how they can be utilized or not utilized. These are sort of big topics that obviously we had to conduct. And finally, what really has been the nucleation point is to develop this legal concept that I briefly alluded to really tie together the technical infrastructure and all our dependencies from international networks to submitters to data requesters into a robust legal framework with countlessly numbered documents. That can only thank the consortium for taking that on and this challenge on and bringing together the legal and the technical side in a unified manner. So now I come maybe to the exciting bit. This is everything we have done, and now what are we working on right now, and what are the future opportunities for us and maybe also for genome medicine as a whole. The first point I would like to highlight is we have achieved a lot, I believe, but it's just one piece of the pie, of the cake, if you wish, namely the legally, technically sound archival of genome data. We enable controllers to archive the data and make it accessible. But there's so much more we need to really free up genome data and make them useful. One element is processing. We would like to do analysis or enable secondary users, and I come to this in just one slide, to conduct analysis on the data very easily, maybe even without having their own compute resources. Such analysis platform should also really close the loop. We would like users to build on data in an archive such as GHGA, but then submit the results back. Yeah? That the results from one scientific investigation are the data of the next scientific investigation. And we can really create this feedback loop, which will be very, very important. And obviously, you can see the complexity of such an infrastructure changes. There's more to be done. Atlasing is, for us, very important. Creating exploration tools, allowing users to access the data maybe before they go in, sign contracts, download petabyte scale data, and really thinking about opening up the data maybe to clinical users, maybe to users who want to get a quick glance before diving in and really going down the route and requesting data sets. And finally, also data services, research tools. What are the tools we need to conduct research? Can we support users in doing that? And I just want to go a dip deeper in this topic of secure processing environment, which I think right now is on, I believe, pretty much everybody's mind, outside also genome data. And just highlighting that right now, what we have in GHGA is this model that once the controller or an appropriate access committee has approved an access request and GHGA has received the signal, data are offered for download. The download is not problematic per se. It's a secure download. It's appropriately encrypted. However, it requires researchers to operate their own local HPC system. And it also requires the researcher to be a trusted entity because they hold the data. Yeah, they could technically misuse the data if you wanted to do so. And obviously, the reason why this might be not very likely is because they're contractually bound to the controller. And in many cases, this might be appropriate. It might be fully satisfactory. In other cases, and I think the sort of dynamics is shifting towards this model, you might want to not permit data download, and a future model might more look like this, namely that upon approval of data access request, the infrastructure GHGA is connected to a compute platform, a secure processing environment that allows users to operate within that platform, bring their algorithms, maybe bring their own data, but not being able to extract results, or at least not extract results without further control mechanisms and checks and balances. This sort of stepping stone, I think, has a number of advantages. On the one hand, it improves data security even further, as mentioned, but it also has the advantage of democratizing research because users do not have to download. They might not even be able to download. We talked about NACO. Raw data will be 1.5 petabytes, just for next year. We talked about the model project. This will be even more petabytes. So data download is also actually rate limiting in many ways. And so there's a number of advantages to this model, and we are very actively working towards offering the first solutions with some of our pilot partners and then hopefully roll out globally. I think we're on a very good path to actually being able to make the first steps in this direction even next year. So this roadmap for us is really thinking about, getting more data in. That's something we're doing very actively now. We're at the moment really also thinking about automating our processes further to really be able to serve what we call unrestricted external submissions, meaning everybody can submit their data. And we would really like to be totally open to everyone. And we hope that's something that we can achieve next year. That's on the archive side. The secure processing environment I just mentioned is something we're starting now. We want to really have the first projects live next year that can use this for selected use cases, I would say. And then build upon that, create new concepts, scale it up, and then really making it available more broadly. There's many questions here, which is why these pipelines are, I think, very careful. One of them is who pays for that? What are the cost models? There's many questions for that. Can we use public clouds? There are many questions to be answered here in this bottom space. And I think that will be one of the larger areas going forward. The other real opportunity I would like to highlight is working together. GHGA is very connected to a number of activities. We're funded by the NFTI, but we now already have very strong ties, for example, to the model project, to the national cohort. We are connected to DENBI, Elixir. We're obviously part of the European Genomic Data Infrastructure and other activities. In many areas, we already have contractual relationship. We receive additional funding mechanisms. So it's in a way a very important network, and we would like to leverage the network going forward and have activities. In the interest of time, I'd like just to highlight one of these networks. that I think fits to today's talk as well and presentations, which is this National Genomic Initiative, which has the mission, and we hear more about this later on, to bring genome sequencing to routine care in rare disease and oncology in a sort of a, narrowly framed context right now for a period of 4 years. It's funded by the health insurance companies, and has or will receive substantial contributions from the Ministry of Health, and will deliver up to 90,000 whole genomes and whole exomes in this period. So it's at least 15 petabyte. That will sort of materialize over the coming years. Actually, this project started in July, so data is actually flowing in a way, or being generated at least as we speak. And GSBA has been involved in a number of areas, and I think the most important one is providing the backbone of managing the genome data, of managing these 15 petabytes and contributing to that. We're operating genome data centers, and we're really, really enthusiastic that we expect that a large fraction of the data being generated in this project will actually also be consented for research. So we can use the data, we can share the data, we can make them available and really follow our mission, link them into European activities from GTI to 1 million genome and beyond. And this red arrow shouldn't be here, but what you see behind this arrow is just giving a glimpse of the infrastructure activities, hospitals depositing data into local trust centers that's prospectively being taken over by the Robert Koch Institute. So there's a big schema of how data will be managed. And these genome data centers, you just about can see here, they're essentially the GHGA data hubs. And we now envision that particularly the research consented data will then also be available via GHGA, and thereby contributing to really the fair and findability. And as you can see in this red banner, you will hear more details from Andreas Till about this activity, and we're really grateful for this interaction and contributing that we can do this activity and helping make the most of this genome data that will be generated in Germany. The final point I would like to make is, these data that we're now coming, 90,000 whole exomes, whole genomes from rare disease and clinical care, and they open up obviously new innovations, things we haven't done. I want to go back to the circle here. I mentioned secure processing is a big topic, but also these services. What would we like to do with the data? What are the services? And we have a number of sort of things in our mind. We would like to reprocess data at scale. There's very strong evidence in rare disease that coherent reprocessing is an opportunity to maybe solve more cases, to help also oncology use cases. We'd like to make variants discovered via beacon services, integrated in GDI and fHeader and EJA, and also variant annotations. And maybe just the final point, I couldn't resist. As I think I mentioned early on, I'm a scientist by training. I think what we also would like to do as a consortium is bring research tools, the latest research to these types of data. This is a project with Julien Gagneux's lab, who's also a partner in GHGA. And what we've built in here is actually a method that allows you to interpret rare variants in genomes, in germline genomes, which can also be applicable to rare disease, and really ask the question, how can we form variants and their annotations, which we have now available? We now know what variants do. We have predictions about whether variants have impactful roles or not. And we can then really go all the way in and estimate how do these variant profiles, these personal variant profiles individuals carry for individual genes, how do they impact gene function? And this is something that maybe sounds a little bit abstract, but I think this picture on the right illustrates this. This is one example for low density lipoprotein. So this is a phenotype. It's one of the important blood markers, and you probably don't want to have your LDL levels very high. And what you can see here is basically what we can do with these methods. Every dot is a person, and we can estimate the relationship between rare germline risk factors in this gene LDLR and your LDL levels, and in particular identifying now really continuous relationships and being able to pinpoint individuals you see on the right here that have an elevated risk of LDL levels. And I think these new tools we would like to bring to data, such as the model project and other activities, to really help the community and really bring the research innovations to data sets like the one I just mentioned. And with this, I'd like to close here. It's really my great pleasure to thank everybody involved in GHGA. It's a huge effort, teamwork, many individuals and people to acknowledge here across all of Germany, many institutions. And you can see the enthusiasm of all contributing to this. And yeah, thank you very much for listening. I look forward to questions.